I'm Polly Dawkins, Executive Director of the Davis Phinney Foundation. Here with us today is Sarah Chen. Sarah, tell us who you are and what your role is in the Parkinson's community.
Sure. I'm Sarah Chen. I'm a social worker at Rush University Medical Center in Chicago, and I work with their movement disorders clinic. I've been at Rush for the past 10 years, and I wear a few different hats at Rush. I'm working on a research study that we'll hopefully be able to share more information in the coming months about with the community. And I help support a couple of their interdisciplinary clinics. And so I set out to work with older adults, but I didn't know that I was going to end up in neurology. And it just so happens that my grandma had Parkinson's disease. So it's kind of come full circle.
Personal and professional for you.
Mm-hmm.
Yeah. So in your role as a social worker, tell us a little bit about your experience navigating the healthcare system and insurance. Is that a big part of that role at Rush?
It is. It's a huge challenge. On both as a professional, helping people understand both what their insurance covers or doesn't cover and how to access those benefits. And even just recently in my personal life too, navigating health insurance. So it's really a really complicated system. If I was in charge, it would be designed very differently, but nobody asked me.
Nobody asked you to design it?
No.
And today we're really talking about the healthcare system and insurance in the United States. And
Yes.
that's what your expertise is, correct?
Yes.
So for those of you who might be tuning in from outside of the United States, this probably wouldn't be as applicable to others.
Thank you for clarifying that. Yes.
Yeah, we do have people who join us from all over the world. So what are some of the biggest challenges that you see, Sarah, in your years working in this field that families or individuals affected by Parkinson's experience as it relates to the healthcare system?
A few big things come to mind. One that I was mentioning, just kind of understanding how to utilize benefits, what benefits cover, and then if there's something that's covered, even understanding how to get that coverage for something. So I'm thinking of like durable medical equipment. People know that they need it, but then struggle to figure out how do we use our insurance to help cover it. And then another big challenge is even then finding providers or finding the right kind of provider, whether it's a physical therapist that's trained with LSVT or the driving evaluation. So just understanding how to navigate things and access to then how you access them, even if you find it.
So before we jump into some specifics, if people in the audience are wondering, how do I find a Sarah in my life? Where is a person who's experienced in this? Can you give some tips on in local communities, how you might find somebody with your level of expertise?
There are social workers in the wild all over. The health center or the hospital near you will likely have social workers. You can ask at your doctor's office to see if they're able to help connect you. Across the US, there are area agencies on aging, and they have social workers that are embedded in the community. That will be a really wonderful resource because they're going to know specifically what's available in your community. And we'll talk about this a little bit later, but there are some programs that are offered to seniors who are using Medicare to help them navigate their benefits. It's called the SHIP program. And so many of the SHIP counselors, you can access them through the area agency on aging. So it's a double whammy that you get connected to community resources and support around navigating health insurance and health insurance coverage.
Super. And for those of you watching today, we will include links to all of the resources that Sarah is talking about, both in the chat and afterwards in our blog post that describes our conversation today.
Yeah.
So let's start with the big one, health insurance. We all need to have health insurance, but we don't really understand it well. Why is it important to start with health insurance and talk about health insurance?
Sure. Health insurance is something that is kind of the key to allowing us to access many of the services or support that we might need. And so people can have a variety of different types of health insurance. You might still be working, and so you may have an employer-sponsored commercial plan through one of the big name health insurance companies. You might be on Social Security disability or on Social Security retirement program and be receiving Medicare for your primary health insurance. You might be receiving some support from your state around health insurance. And so you might be receiving a state-sponsored health insurance plan. Mm-hmm. So there's just, because there are so many different types of plans, and within those plans, so much variety, it's important to kind of have a general understanding of the type of coverage you have, so that then you can leverage that coverage to meet as many of the needs as you can get out of it. We really want to make the most of the health insurance that you have, and help it work for you as much as possible.
Yeah, that makes sense. So you mentioned Medicare, and we also know that there's something called Medicaid. Can you tell us a little bit about Medicare, as that's probably most of our audience is grappling with or starting to learn about Medicare, but also touch on what is Medicaid and what the difference between the two are?
Sure. And it's very confusing because the names are so similar. So Medicare is the federally funded health insurance plan for seniors who are 65 and over, and for people who are receiving Social Security disability. And you only become eligible for Medicare after 24 months of being on Social Security disability. So one of the challenges for that population is you don't automatically get the Medicare coverage right away. And that's another place where I would have an opinion that I think insurance is very important, but that's something to keep in mind. And so Medicare has several parts to it. There's the Part A, that's the hospital benefit, broadly covers a hospitalization and things associated with a hospitalization. Medicare Part B is the benefit that covers outpatient services. So when you go to see your primary care physician, go to see your neurologist, go to see the physical therapist, that would be covered under Medicare Part B. And then Medicare Part B is the prescription drug coverage. And that's a separate plan that you can enroll in annually. You can verify your benefits, make sure it's the right fit for you. There's an open enrollment period annually from mid-October to early December that you can change benefits if that makes the most sense. And so those three pieces, Medicare Part A, B, and D, are what many people have. There are what are called Medicare Advantage plans that roll the Medicare A and B, the D, and a supplement together. This is where it gets so complicated, Polly. There's so many different types. So the Advantage plans will roll it all together, and it can be much simpler because it's just all one thing. You're not navigating these several different coverage plans. However, the trade-off can be the Advantage plans can act a little bit more at times like an HMO. So they might restrict where you can go to be seen. Whereas, or if you travel, I'm in the Midwest, we have a lot of snow, what we call snowbirds. So people who go someplace warmer in the winter, I don't blame them. So their Medicare Advantage plan, those are geographically specific. So if you're in Illinois, let's say, and then you go to Florida, it can be a little complicated. You still have benefits, but it can be a little complicated to access some of those benefits in Florida with an Advantage plan. Whereas if you have traditional Medicare, it works all over the country, wherever you are. And you can generally be less restricted about where you go for care, as long as the place you're going accepts what they call traditional Medicare. And so I mentioned this earlier, I'm going to come back to it. The Senior Health Insurance Program, or SHIP as the acronym, is a wonderful program for Medicare recipients or those who are going to be signing up for Medicare as they're getting closer to their either 65th birthday or their kind of eligibility period. Those counselors do not work for an insurance company. They're trained by the states to help you look through your benefits and your needs and figure out what might be the best options.
Oh, wow.
And also help you just kind of find unbiased information that you can look through to do some more research. So I can't speak highly enough about the benefit of speaking with a SHIP counselor. And so just because Medicare is so complicated, I would say that's the best bet of a place to start.
And is that assistance through SHIP free of charge, or is that something somebody would pay for?
No, it's generally free of charge, and it's run by the states. So in the link that we are providing, you can follow the link, look by your state, and many of them have a phone number that you can call to get connected to your local SHIP program. But they're usually free.
That is very confusing. And I think when this recording comes out, people will have to watch what you've just said a few times and listen and go to that SHIP link and start to navigate that more easily.
It is very complicated. And you also had asked me what's different between Medicare and Medicaid. And so Medicaid, or some version of that word, is usually the public health insurance program that's run by the state. And they're state-specific programs that have their own criteria for eligibility. So some of them have programs specifically for children and the elderly. Some of them have been expanded to cover more populations or groups of people with disabilities. And they ask about, or a consideration is income or assets or work. So every state can design their program a little bit different. But if you want to learn more about your state-specific health insurance coverage, you might want the Area Agency on Aging, again, is going to be a really great resource to get more information, as well as you can look on your state's like Department of Human Services page to find more information about the insurance plans that might be offered. I would say there's a few things you want to keep in mind. One being the open enrollment period for prescription drug coverage if you're a Medicare recipient. So those Part D plans can change year to year. And you might be on a plan this year and it's working great. And you're like, I would love to keep this same coverage. I don't want to change anything. Well, the caveat is your insurance company can make changes, just like you can make changes during open enrollment for the next calendar year. So can your insurance company. So if they've been covering your medication this year, it's not a guarantee that it's going to be covered the exact same way next year. So I would highly encourage you to take a look at your plan, and with the information you have now, try to make the best decision to just verify, if I were to be on the same drug regimen next year, will things still be covered very similarly to what I have now? And if not, if they're saying, oh, this medication is going from a tier 1 where it's getting a lot of coverage to a tier 3 where it's getting more minimal coverage and there's going to be more patient responsibility for that cost, it might be time to look at other plans to see if there's another option that's going to serve you better.
And
The other consideration might be, as you're electing a plan, whether it's a Medicare Advantage plan or a supplemental coverage plan to go with your traditional Medicare Part A and B, thinking about what, if you know you have a neurodegenerative disease, things may change down the road. And do you want to have the option for access to other providers? Right now, things may be great and you're not needing anything more, but maybe in a year or two, you're going to want to have the opportunity to go see a speech therapist or physical therapist. And the physical therapist in your network may not have the specialized training. So that's just something to keep in mind, to give yourself that possibility of seeing providers who are a little more equipped to potentially serve the unique needs that this population might have.
Super. I'm going to come back to a question about special enrollment, but before we do that, you've been talking about prescription medications, and that is such an important part of living well with Parkinson's, is access to the right medications and the cost of those medications. Do you have strategies or ideas for people to receive assistance paying for their prescriptions, or could you talk a little bit about that?
Yeah, such a challenge. There are a couple ideas that come to mind. One is a program through Medicare called Extra Help. It's a program designed to help support the cost of Part D prescription, the deductible or the premiums. And so you can apply for that program on the Medicare website, and see if you might qualify for Extra Help. Another consideration to think about is if you have prescription drug coverage, you may be able to advocate for what's called a tier exemption for some of your medication. So like in the example I used before, a medication might be on the highest tier. So there's a large out-of-pocket cost to you. You can advocate with your insurance company for a tier exemption to potentially have that tier 3 medication move to a tier 2 and have more coverage by your health insurance. It's not a guarantee. It can kind of be annoying, and you may have to redo your tier exemption annually if your plan changes. So I just want to name the fact that that's really annoying and doesn't always get, like it might take a few months for that to kick in. So you still may be paying the higher out-of-pocket cost initially until you are able to get them to approve the exemption. But that's another way to kind of advocate with your current coverage. Some of the manufacturers offer assistance programs for the medications, though the caveat being sometimes they exclude people who have Medicare or who have commercial insurance. So there can be, you've got to read this fine print because there can be some exclusion criteria that may not work the best for you. Some of our folks find that if they use a coupon through a program like GoodRx, that might actually be less expensive out of pocket than if they go through their prescription drug coverage. So you can search by pharmacy and location, and sometimes one pharmacy is significantly less expensive than another pharmacy for the exact same quantity of medication at the exact same dose. So don't be afraid to shop around, and your doctor's office will transfer the prescription, or the pharmacy can transfer to the other pharmacy. So you feel confident to do what makes the most sense for you to help make those prescriptions more affordable so that you're able to get the support and live as well as you can with the medication.
We have a question from Lorraine in the chat. Sarah, do you have a simple explanation for the donut hole? We often hear that. What is that? And can you tell us about that?
Okay, Lorraine, I'm going to do my best to try to make this simple. The first thing is the donut hole is closing. It's going to take a few years. I can't exactly remember when it's going to end, but it's coming. The hole is getting smaller. The donut hole is basically you have coverage up to a certain amount, and then once you hit that amount, it drops off until you hit another amount, and then the coverage picks back up at a larger percentage. So the donut hole is basically kind of the cliff in drop off of coverage where you fall in, and then as you make your way through, you come back out and get additional coverage.
And that's for Medicare.
Yes, thank you, Polly. Yes, it's a Medicare prescription drug donut hole.
And so what do people do during that cliff, during that hole?
I know cliff is not the best word. Donut hole is better. Yeah, it's really hard. That's when utilizing the coupons can be really helpful. That's where the tier exemptions can be really helpful. Just trying to minimize as much of the out-of-pocket costs to patients as possible. For some people, they hit that donut hole really early in the year, depending on how much medicine they're taking. So if that's the case, you know, you might be able to anticipate it a little bit, trying to refill as much as you can before the end of the year so that you're not hitting the donut hole all at once with all of your medications needing to be refilled. You can kind of stagger it a little bit so that if you're on a fixed income 1 month, you're not getting like $600 of out-of-pocket cost that is unexpected for your medication. That maybe that can be spread out a little bit if you're able to stagger when some of those refills need to come in. But I don't have a good answer. It's really hard. And my answer is holding on to the fact that that hole is closing. So it's coming. There's end in sight.
Thank you. Cheryl asks us, is there an annual dollar limit on Medicare's coverage of physical therapy?
Oh, I know this one. Yes, there is. I was scared where you were going, Polly. I will say I am not a SHIP counselor. So the SHIP counselors are your experts to like all of the coverage. I know enough to be dangerous. But there are limits for physical therapy coverage and for occupational therapy coverage and for speech therapy coverage. The unfortunate thing is the way the Medicare is set up, your limit for physical therapy includes speech therapy. Those are tied together in the same bucket. And then occupational therapy is a separate bucket. I said I know the answer. I don't know the exact dollar amount for the 2024 like year. It's roughly around $1,900. Now, there are ways that you can exceed that dollar amount of therapy if, heaven forbid, you like fall and break something and you've already done therapy in February and all of a sudden you need some more therapy in April. There are ways that you can exceed the amount of therapy or that dollar amount. The physical therapists just have to do a little bit more documentation and advocate for that additional therapy, but it is possible. You're not completely cut off from therapy for the year. So it can be helpful to try to bear in mind that there's a limit and spread out your therapy a little bit, do some at the earlier in the year, and then try to hold off, do your exercises, the things the therapist recommend, and then maybe come back a little later in the year to do some more therapy, just so that you hold on to a little bit of that coverage for later in the year so that you're not without it again until the new calendar year begins.
Could you briefly talk about this notion of special enrollment?
Yes. So there are some certain circumstances that may trigger what's called a special enrollment period. And a special enrollment period, and we're going to put a link in the chat because I may not get all of this exactly right, but there are life events or instances that trigger a special enrollment period. One of them could be if you're in a Medicare Advantage plan and you move geographic addresses. Your Medicare Advantage plan is geographically tied. So if you move from Illinois to Arizona because it's warmer, you get a new special enrollment period for that. You can tell I'm fixated on warm weather. You can pick a new plan that's going to cover where your new location is. The same thing is for prescription drug. The Part D plans are also geographically tied, so you can qualify for a special enrollment period for that. If you've been on employer-sponsored insurance and you've delayed taking Medicare beyond your 65th birthday, so let's say you're 67 and a half, you've retired and you want to opt into your Medicare, at that point you qualify for a special enrollment period. If you've had Medicare Part A but have been on a spouse's plan, or you kept it and you also kept your commercial insurance and you lose that insurance because you retired or something changed, a special enrollment period. So there are certain circumstances that allow you without a penalty to opt into some of these plans. And so if those are available to you, usually the special enrollment period is about 3 months. So you want to take advantage, act quickly, I guess, if you're anticipating a change. Try to do as much ahead of time or to prepare or kind of keep it on your radar so that you don't miss that special enrollment period. If you have questions, you can always call the Medicare 1-800 number or go into the Social Security office or contact a SHIP counselor, and they'll be able to help you understand kind of what is your time frame you're looking at for that special enrollment period, or do you qualify for a special enrollment period?
Wow. We can see why everybody needs you on their team, Sarah, to help us. But the SHIP program sounds like it's really going to help us out in figuring all this out for ourselves.
Yeah.
So Doris asks a question related to Medicare Advantage. How easy is it, if she's on Medicare Advantage, how easy is it to switch to supplemental plan? Do you know that?
I do. There is, you can opt, Doris, my easy answer is talk to a SHIP counselor. They'll be able to help walk you through it. You can opt out of a Medicare Advantage plan there is an open enrollment period where you can switch from one Advantage plan to another Advantage plan. That happens annually, and we're in the middle of it right now. So the open enrollment to switch Advantage plans happens from January to the end of March. So you can reevaluate your coverage now. If you want to opt out of Medicare Advantage into traditional Medicare, many states offer, or you're limited in what you can pick up for a supplement at that point. But many states offer what's called a guaranteed issue plan for the supplemental coverage. And the caveat being sometimes those guaranteed issue plans may be a little more expensive for the out-of-pocket premiums, or some of them at that point can ask for a little bit more of your health history, which they can't ask for when you're first signing up for Medicare at either 65 or when you first take it. So I would look at that guaranteed issue plan closely and just kind of understand what's involved with that. But it is an option. The other thing is maybe you just want to switch from one Advantage plan to another. Those can also be an option if there's something about your Advantage plan that's not fitting your needs at this point. Talk to a ship counselor.
Yeah, that sounds like a great idea.
You're going to be sick of hearing me say that, and they're going to get a ton of calls, and that's what they're there for.
I got a question that's come in directly. A person says, I am 55 and work full-time. So I'm covered by commercial insurance plan from my employer. We changed insurance this year, and miraculously our new insurance approved prescription for a Rytary. If we were to change insurance again in the next year or two and the new insurer excluded Rytary being a primary Parkinson's med that this person's taking, does the fact that it's a current medication help when appealing that exclusion?
That's a really great question. It may or may not help. If if the employer is totally switching the plan, like let's say they're going from one major commercial insurance company to another major commercial insurance company, not to name names, but just they're switching from one to another. Those plans can be totally different. And just because one plan covered it, it doesn't automatically mean that the other, that you're going to be kind of grandfathered in for coverage on the new policy. However, you can certainly advocate to say, like, this is a medication that's really critical to my independence and feeling as well as I can feel. Your physician may be willing to write a letter to also support that appeal to the insurance company. So it could be covered. It just might take a little advocacy initially if your plan were to change. I hope it doesn't, because I'm thrilled that you're not having any issues getting your Rytary. I want you to be able to keep getting it easily.
Yeah, agreed. You know, you started touching on a question that Kathy has, which is how do you get your insurance to pay for something that's not normally covered by insurance? And you started saying, ask your doctor to write an appeal. Can you describe a little more about what that strategy is?
Yeah, and maybe I can back up a little bit and even say there are certain things that the insurance will cover and certain things that they won't cover. So some of those bigger categories of like what they won't cover, but I wish they did, were like a ramp for the front of your house if you had stairs that would make it easier to get in and out of your house. Your insurance is not going to cover that. Insurance covers durable medical equipment, and they cover some specific types of durable medical equipment, but they don't cover all of the durable medical equipment that's available. So there are some limits to what you can get covered. Now, let's say you need a wheelchair to get around, and there are different types of wheelchairs. A transport wheelchair is the lighter weight wheelchair that's easier to get out of the trunk of the car because it's only 25 pounds versus like 60 pounds. The transport wheelchair is going to be less expensive. If you needed a more complex wheelchair or an electric scooter type wheelchair, you can go to a like physical medicine and rehabilitation doctor. Many of those have like wheelchair clinics where they can write the documentation that would be needed to support some of these specialized pieces of equipment. And so in that case, I would want to have my insurance cover as much of that scooter as possible. And the transport wheelchair that is useful, but probably only $150, I'll buy that $150 transport wheelchair and I'll let my insurance cover the $1,000 electric scooter. So some of it is kind of being a little judicious about which thing do I want to get my insurance company or add to try to help them cover. Because there's rules about how often you can get new durable medical equipment, let's say. For Medicare, it's every 5 years. Your commercial plans might be a little different, so I can't speak to the fine print of those plans. So Medicare will cover a short-term rehabilitation stay in a facility, like you've been hospitalized and you go to the rehab facility for a month, get your strength back, and then go home. Medicare or your insurance will cover that. There might be some out-of-pocket cost you're responsible for, but the majority of it will be picked up by the insurance. Your insurance, commercial insurance or Medicare, are not going to cover long-term stays in a facility. So there's some distinction around like what the insurance will cover and won't cover, and kind of where you can try to advocate for a little bit more and what's outside of what you can advocate for. So a tier exemption for a medication, absolutely. Additional physical therapy because there's a demonstrated need, absolutely. A specific test that maybe they're like dragging their feet about, or they're saying, well, you like just had a swallow evaluation 6 months ago and your doctor is saying like, I'm concerned, I think we need to repeat it. Absolutely. Like those are places where use your energy to advocate for the possibility of coverage. But if you're saying, I'd like to have my bathroom remodeled and I'd like my insurance to help cover the cost of that remodel so that it's more accessible to me, I'm sorry to say your insurance is not going to help cover that. And I wouldn't waste your time trying to fight for something like that. Does that make sense?
Yeah, it does. Unfortunately.
Unfortunately. Yeah.
So we've spent the majority of our time here talking about insurance and Medicare, and it's such a big topic. I would like to spend the last 20 minutes or so we have together talking about navigating the healthcare system. Of course, insurance and Medicare is a big part of that. But to start off, as somebody enrolls in Medicare, how do they find a provider who will best meet their needs?
Sure. There's a few ways. Your current provider may be a provider that accepts Medicare. And so you can stick with that person. And if you have questions, you're going to enroll and you're wondering, can I keep my doctors? Ask, do you take Medicare? Do you take Medicare Advantage, Silver, Gold, blah, 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 whatever type of Medicare Advantage plan? Ask. And then you'll have a better idea of what am I working with? Well, I can see my pulmonologist and my neurologist, but maybe I need a new primary care doctor. So if that's the case, then I have a few suggestions. First of all, ask around. Ask your friends, who do they see? Do they like them? Do they have the same kind of insurance that you do? if your friends have Medicare and they love their primary care doctor, I would start there. If you're comfortable, you trust that friend and you want to try it, go for it. If you're looking for a provider, there is a website through Medicare where you can look for certain things. So you can search for a provider, you can search for a durable medical equipment supplier, you can search for long-term care or like the rehab facilities that are accepting Medicare.
Mhm.
That link will go in the chat if it hasn't already. So you can use that link, you search by your zip code, and it will tell you the providers that theoretically accept your insurance. When you call to schedule, I would just verify that, yes, you're still accepting Medicare, but most likely they are. So that's
That's
probably
helpful.
how I would start.
That's great. You know, you touched on long-term care, and we've got a bunch of questions coming in about long-term care. So when is it easy, or is it possible to switch from Medicare to long-term health care if somebody needs medical or assisted living help?
So I think what the question is Medicare does not pay, like commercial insurance, Medicare, they don't pay for long-term care and they don't pay for the cost of care in an assisted living facility. Now, some states, I can speak for the state of Illinois specifically, because that's the one I'm most familiar with. But most states will have coverage for long-term care through the state health insurance program. So if you qualify for the state health insurance program, then that program will help cover the cost of long-term care in specific types of facilities.
Mhm.
So that also depends on the state. For example, in Illinois, we can use the state-sponsored health insurance plan, which here is called Medicaid. Medicaid will cover care in a nursing home, and it will cover long-term care in what they call a supportive living facility, but that will not pay for care in assisted living. And it all has to do with the way the Department of Health in Illinois has set up the licenses for each of those levels of care. So you will want to ask the area agency on aging in your community, how has my state's health insurance plan set up coverage for long-term care? What will they pay for? What won't they pay for? Or where will they pay for care? So you can keep your Medicaid. And let's say in this example, in Illinois, if I'm in my home and then something happens and I no longer can be cared for at home, or I just don't want to deal with the house and all of those responsibilities, and I'd like to go someplace where I can get more support and I have less responsibility, but I can't necessarily pay for it. I can keep my Medicare coverage, and if I qualify for Medicaid, I can have Medicare and Medicaid at the same time. I don't have to forego one to have the other. They work together. So it's a little more complicated than that, just like making sure you're in the right types of plans that work together and cover what you need. But broadly speaking, they can work together, and you don't want to give up your Medicare. Keep your Medicare. You keep it.
Good point. And as you said, this is very state specific, so everybody needs to work in their own states to understand.
Yeah, I wish it were simpler and more broad, so that I could say the coverage in Colorado and the coverage in Massachusetts and the coverage in Washington their state programs are all the same, but there are 50 states with 50 different programs. So
And somebody asks about long-term, should seniors consider long-term care insurance?
It can certainly be helpful if that's something that's feasible for you. Long-term care insurance can help offset the cost of care, and it depends on the way the plan is written. Some of the plans will cover like a per diem per day, and that per diem could be used to cover a caregiver that comes to the home. It could be used to cover the cost of an adult day program, or it could be used to cover the cost of assisted living or a skilled nursing facility. So you just want to take a look at the plan and make sure it's going to work the best for you. Some of them are written that you get up to a certain dollar amount of coverage, regardless of the time it takes you to reach that dollar amount. Some of them say once you activate it or trigger it, you have X number of years. And then regardless of how much you have used of that plan, the time limit has elapsed. So they can certainly be helpful, but they are all private pay, so there is certainly a cost associated with them.
We have another question about long-term care insurance. We have a question from Lorraine again. She says that she's working with somebody, a friend, to help them navigate Medicare and long-term insurance. And it's been really easy to pay the premiums for the long-term care insurance, but getting them to begin paying, getting the long-term care to begin paying has been multiple hoops they've had to jump through. Who can help with this? Is the local area on local
Area Agency on
Thank you.
Aging.
Is that
They may be able to help kind of sort, like sit down with you and sort it through. Sometimes people might use a geriatric care manager, which would be private pay, but you would pay specifically for like an hour or two or whatever it took to kind of sort through it. Or you could say, I'm willing to pay for an hour. I need some help kind of understanding what am I missing? Like we've done X, Y, and Z in Lorraine's case, and we're still running up against roadblocks. What are we missing? Can you give us another set of eyes? So I would start with the Area Agency on Aging, but if they're not able to help you, maybe a geriatric care manager, or see if there's someone else through like the doctor's office or something that might be able to help.
And would that type of resource, either of those, be able to help? Doris asks if you can no longer put claims in on your own. Who can help with that part?
Making claims to your long-term care insurance, maybe?
Yeah.
Okay. So I think this is where maybe we think about whether we have a partner or not. Like who can, maybe our partner, even if we had one, they're not equipped to be able to help us do this. Who else in our network or our community can we help leverage for some of these things? Whether or not you have an adult child, that adult child could live halfway across the country. Some of these things maybe they could do remotely. So if you had a child that could help make some of those claims, even if they lived out of state, they could help manage that aspect. But some of it also might be thinking about who else is in your community through those social networks that you've been a part of for so long, or are new to, but have made friends. Who else could you help you, whether it's a faith community or friends from your previous job or a Rotary Club or some organization you were involved in. Sometimes people are very willing to help, but they don't know what you need help with. And so it might be thinking about how do I take people up on their offers to help? And it could be, I really could use help like sorting through these claims. And I might not be the best person for that, but an accountant, if someone worked as an accountant and they're retired and they're offering to help you, Well, that would probably be a fantastic job for them. And you ask your friend who, you know, is a really great home cook and you need a little bit of help with meal preparation, I would say ask your friend who's a great home cook to maybe double batch some meals and make those and let your retired accountant friend help with the claims. I know this is really simplifying matters. People don't always have these supports around them, but I suspect that you probably have more than you think you have for many people. And it's uncomfortable, but it's thinking about, it's asking or it's taking people up on those asks with some like very specific tasks.
Great points, really great points. We have 5 minutes left, and this is going to feel a bit like those fast questions at the end of a game show. I'm going to pepper you with some different support systems and ask you about what is in-home care.
Broadly, in-home care is someone that is coming into the house to help you. And that can look a whole lot of different ways, but generally it's private pay or through a program through your state. And the Department on Aging is going to be able to tell you what program is available in your state and the eligibility criteria.
The VA, does the VA have?
Oh yeah, that's a fantastic, yes, Polly, the VA does. If you're a veteran, get connected to the VA care and support program. They have a 1-800 number that I did not provide, Polly, but we'll make sure that I get to them. Call that number, and if you're not connected yet, go through the steps to get connected to the VA and get as much as you can through them. They have a fabulous program that can help support prescription drugs, in-home care, physicians, all kinds of stuff. So.
Okay, so that's in-home care. Then what's home health care?
Home health care is something that is covered by the health insurance with a prescription from your doctor. It's usually after an illness or hospitalization where a nurse, physical therapist, occupational therapist, bath aide come in for a time-limited period to help you regain strength and mobility.
We talked a little bit about assisted living, Sarah. Tell me what assisted living looks like. What is that?
Assisted living is where you may have your own apartment, whether it's like a studio or you have a little kitchenette. You're still probably able to get yourself dressed. You're still probably able to get yourself to the washroom or in and out of a chair, but you get your meals prepared for you. There is support there 24 hours a day. It may not always be a nurse, but there's someone there if there's an emergency. And then you can have, and they'll provide housekeeping. And then you can often opt in for some additional a la carte services, like they set up your medication in your pill box every week and reorder it, or provide transportation to doctor's appointments, or help with showers multiple times a week or something like that. So you're still fairly independent-ish, but you're starting to get a little additional help, and it's private pay.
I was just going to ask, Medicare doesn't cover.
It doesn't.
And if somebody finds themselves, can you remind me, if somebody finds themselves at a situation where they really do need that level of assistance, but Medicare doesn't pay, is that through the Medicaid or is that through the state?
It would be through the state health insurance program that might help cover the cost for long-term care in sort of whatever they call that assisted living like setting. And if you need more care, if you're needing more help with your activities of daily living, self-care tasks, getting up, getting dressed, getting to the washroom, getting your medication, getting your meals, you would probably be better served in a skilled nursing facility where there are nurses 24 hours a day that are managing your medication and able to help with that additional level of support. Now, I will say that sometimes people face challenges when they go into facilities, especially folks with neurodegenerative diseases, about maybe getting their medication on the same time schedule that they had been at home. So some of that is like, there's a lot of benefits to being at home. There's a lot of benefits to being in a facility. There's no right or wrong way to do this, but just recognizing that sometimes there can come with a little bit of trade-offs and how you advocate in those situations, whether it's educating the staff in a facility to say, I really need my medication as close to on time as possible. Otherwise, I really I can't feed myself my lunch if I don't have my cinnamon or carbidopa. Like, so it's advocating and figuring out how you navigate through. But they serve a really important purpose and maybe a really good fit for kind of what your needs are down the road if something changes.
Thank you. Sarah, we have covered so much. I feel as though we've given a basic primer to a lot of folks in a bit of a fire hose.
I was going to
method.
say it's a crash course.
Thank you, Sarah, for your hour. It was filled with such good information. And thank you for the work you do in the Parkinson's community.
No, thank you for having me. I
Yeah.
hope that this is, at least, I know we can't cover all of it, but I hope it gives people an idea of where to start or what to ask for or how to think a little bit outside the box. So,
Absolutely. Thank you, everybody who joined us today. Be well. We'll talk with you soon.